Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A client arrives at the emergency department with crushing chest pain radiating to the left arm. Which condition should the nurse suspect first? A. Asthma. B. Myocardial infarction. C. Pneumonia. D. Pulmonary embolism. Correct answer, B. Myocardial infarction. Rationale: crushing chest pain that radiates to the left arm is a classic symptom of myocardial infarction, MI. Question 2. Which cardiac biomarker is the most specific for diagnosing a myocardial infarction? A. Creatinine. B. Troponin. C. Hemoglobin. D. Sodium. Correct answer, B. Troponin I. Rationale: troponin is the most sensitive and specific biomarker for heart muscle injury. Question 3. Which action should the nurse perform first when a client reports chest pain suggestive of an MI? A. Obtain a 12-lead ECG. B. Encourage the client to walk. C. Offer a meal. D. Place the client in Trendelenburg position. Correct answer, A. Obtain a 12-lead ECG. Rationale: a 12-lead ECG should be obtained as soon as possible to identify myocardial ischemia or infarction. Question 4. A client with an acute MI is prescribed aspirin. What is the primary reason for administering this medication? A. Reduce pain. B. Prevent platelet aggregation. C. Lower blood pressure. D. Decrease cholesterol. Correct answer, B. Prevent platelet aggregation. Rationale: aspirin reduces platelet clumping, helping prevent further blockage of the coronary artery. Question 5. Which assessment finding is most concerning in a client with an acute MI? A. Chest pain rated 8 out of 10. B. Blood pressure of 88/54 mm of mercury. C. Heart rate of 84 beats/min. D. Oxygen saturation of 97%. Correct answer, B. Blood pressure of 88/54 mm of mercury. Rationale: hypotension may indicate cardiogenic shock or poor cardiac output and requires immediate attention. Question 6, SATA. A nurse is assessing a client with an acute myocardial infarction. Which findings are expected? Select all that apply. A. Chest pain. B. Diaphoresis. C. Nausea. D. Shortness of breath. E. Bradycardia. Correct answers, A, B, C, D. Rationale: common MI symptoms include chest pain, sweating, nausea, and shortness of breath. Bradycardia is less common than tachycardia. Question 7. Which medication is commonly administered to relieve chest pain during an MI? A. Nitroglycerin. B. Metformin. C. Acetaminophen. D. Amoxicillin. Correct answer, A. Nitroglycerin. Rationale: nitroglycerin dilates coronary arteries, improving blood flow and relieving ischemic chest pain. Question 8. A client asks why oxygen is being administered during an acute MI. What is the best response? A. It helps lower your blood pressure. B. It increases oxygen delivery to the heart. C. It prevents infection. D. It dissolves blood clots. Correct answer, B. It increases oxygen delivery to the heart. Rationale: oxygen helps improve oxygen supply to the ischemic myocardium when indicated. Question 9. Which complication is most likely to occur within the first 24 hours after an MI? A. Cardiac dysrhythmias. B. Osteoporosis. C. Appendicitis. D. Liver failure. Correct answer, A. Cardiac dysrhythmias. Rationale: dysrhythmias are the most common early complication following an MI. Question 10, SATA. A nurse is teaching a client about reducing the risk of another myocardial infarction. Which instructions should be included? Select all that apply. A. Stop smoking. B. Take medications as prescribed. C. Follow a heart-healthy diet. D. Exercise is recommended. E. Stop medications once you feel better. Correct answers, A, B, C, D. Rationale: lifestyle changes and medication adherence reduce the risk of future heart attacks. Medications should never be stopped without provider guidance. Question 11. A client with an acute MI is prescribed morphine. What is the primary reason for administering this medication? A. Increase heart rate. B. Relieve chest pain and reduce cardiac workload. C. Lower blood glucose. D. Prevent infection. Correct answer, B. Relieve chest pain and reduce cardiac workload. Rationale: morphine relieves pain, decreases anxiety, and reduces the heart's oxygen demand. Question 12. Which ECG finding is most commonly associated with an ST elevation myocardial infarction, STEMI? A. ST segment elevation. B. Peaked T waves. C. Short PR interval. D. Delta waves. Correct answer, A. ST segment elevation. Rationale: ST segment elevation indicates complete coronary artery occlusion requiring urgent treatment. Question 13. A client is scheduled for primary percutaneous coronary intervention, PCI. What is the purpose of this procedure? A. Remove lung fluid. B. Restore blood flow to the blocked coronary artery. C. Repair a heart valve. D. Lower blood pressure. Correct answer, B. Restore blood flow to the blocked coronary artery. Rationale: PCI opens the blocked coronary artery and restores blood flow to the heart muscle. Question 14. Which assessment finding requires immediate nursing intervention after an MI? A. Heart rate of 42 beats/min with dizziness. B. Pain rated 2 out of 10. C. Respiratory rate of 18 breaths/min. D. Blood pressure of 126/78 mmHg. Correct answer, A. Heart rate of 42 beats/min with dizziness. Rationale: symptomatic bradycardia can decrease cardiac output and requires immediate evaluation. Question 15, SATA. A nurse is caring for a client after an MI. Which nursing interventions are appropriate? Select all that apply. A. Monitor ECG continuously. B. Assess chest pain regularly. C. Administer prescribed oxygen. D. Encourage complete bed rest for several weeks. E. Monitor vital signs frequently. Correct answers, A, B, C, E. Rationale: continuous monitoring, pain assessment, oxygen, when indicated, and frequent vital signs help detect complications early. Prolonged bed rest is not recommended. Question 16. Which medication is commonly prescribed after an MI to reduce the heart's workload and prevent another heart attack? A. Beta blocker. B. Antibiotic. C. Antacid. D. Insulin. Correct answer, A. Beta blocker. Rationale: beta blockers reduce heart rate, blood pressure, and myocardial oxygen demand. Question 17. A client asks why they are taking a statin after an MI. What is the best response? A. It lowers your cholesterol and helps reduce future cardiac events. B. It treats chest pain. C. It dissolves blood clots immediately. D. It increases your heart rate. Correct answer, A. It lowers your cholesterol and helps reduce future cardiac events. Rationale: statins lower LDL cholesterol and reduce the risk of another myocardial infarction. Question 18. Which complication is the leading cause of death within the first 24 hours after an MI? A. Cardiac dysrhythmias. B. Pneumonia. C. Kidney stones. D. Deep vein thrombosis. Correct answer, A. Cardiac dysrhythmias. Rationale: life-threatening ventricular dysrhythmias are the most common early cause of death after an MI. Question 19. Which lifestyle change should the nurse emphasize to reduce the risk of another myocardial infarction? A. Smoking cessation. B. Drinking more caffeinated beverages. C. Avoiding all physical activity. D. Increasing sodium intake. Correct answer, A. Smoking cessation. Rationale. Quitting smoking significantly lowers the risk of recurrent cardiovascular events. Question 20, SATA. A nurse is teaching a client recovering from an MI about discharge instructions. Which statements indicate understanding? Select all that apply. A. I'll take my medications exactly as prescribed. B. I'll call my provider if I have chest pain. C. I'll attend cardiac rehabilitation. D. I'll follow a heart-healthy diet. E. I'll stop my medications if I feel better. Correct answers: A, B, C, D. Rationale, medication adherence, recognizing symptoms, cardiac rehabilitation, and a heart-healthy diet help prevent another MI. Medication should not be stopped without provider approval. Question 21. A client with an acute MI suddenly reports severe shortness of breath. Which complication should the nurse suspect? A. Pulmonary edema. B. Appendicitis. C. Asthma. D. Kidney stones. Correct answer, A. Pulmonary edema. Rationale, left ventricular failure after an MI can lead to pulmonary edema and severe dyspnea. Question 22. Which laboratory value should the nurse monitor most closely after administering thrombolytic therapy? A. Signs of bleeding. B. Blood glucose. C. Potassium level. D. Calcium level. Correct answer, A. Signs of bleeding. Rationale, thrombolytics increase the risk of bleeding and require close monitoring. Question 23. A client recovering from an MI asks when exercise can be resumed. What is the best response? A. Follow your healthcare provider's recommendations and attend cardiac rehabilitation. B. Avoid exercise permanently. C. Start lifting heavy weights immediately. D. Exercise only if chest pain occurs. Correct answer, A. Follow your healthcare provider's recommendations and attend cardiac rehabilitation. Rationale, cardiac rehabilitation provides a safe, supervised plan for returning to activity. Question 24. Which assessment finding suggests the client is responding well to treatment for an MI? A. Chest pain has resolved. B. Blood pressure continues to fall. C. Increasing shortness of breath. D. Persistent ST segment elevation with worsening symptoms. Correct answer, A. Chest pain has resolved. Rationale. Relief of chest pain is one indicator that treatment is improving myocardial perfusion. Question 25, SATA. The nurse is teaching a client about medications prescribed after an MI. Which medications may be included? Select all that apply. A. Aspirin. B. Beta blocker. C. Statin. D. ACE inhibitor. E. Amoxicillin. Correct answers, A, B, C, D. Rationale, aspirins, beta blockers, statins, and ACE inhibitors are commonly prescribed after an MI to reduce the risk of future cardiac events. Question 26. A client reports chest pain that is not relieved after taking 1 dose of nitroglycerin. What should the nurse instruct the client to do? A. Call emergency medical services immediately. B. Wait until the pain resolves. C. Drive to the hospital. D. Take no further action. Correct answer, A. Call emergency medical services immediately. Rationale, chest pain that persists after nitroglycerin may indicate an acute MI and requires emergency medical care. Question 27. Which diet should the nurse recommend for a client recovering from an MI? A. Low saturated fat and low sodium. B. High sodium. C. High cholesterol. D. High saturated fat. Correct answer, A. Low saturated fat and low sodium. Rationale, a heart-healthy diet helps reduce the risk of another myocardial infarction. Question 28. A client recovering from an MI becomes anxious and restless. What is the nurse's priority action? A. Assess the client's vital signs and chest pain. B. Leave the client alone to rest. C. Encourage vigorous exercise. D. Offer a large meal. Correct answer, A. Assess the client's vital signs and chest pain. Rationale: anxiety may indicate worsening ischemia or another complication and should be assessed promptly. Question 29. Which finding places a client at the highest risk for myocardial infarction? A. Smoking 1 pack of cigarettes daily. B. Drinking adequate water. C. Eating vegetables regularly. D. Walking 30 minutes daily. Correct answer, A. Smoking 1 pack of cigarettes daily. Rationale: smoking is a major modifiable risk factor for coronary artery disease and myocardial infarction. Question 30, SATA. The nurse is educating a client on warning signs that require immediate medical attention after discharge. Which findings should the client report immediately? Select all that apply. A. Chest pain. B. Shortness of breath. C. Fainting. D. Palpitations. E. Mild hunger. Correct answers, A, B, C, D. Rationale: chest pain, difficulty breathing, fainting, and palpitations may indicate a recurrent cardiac event or complication and require immediate evaluation.
What was your score out of 10? Comment below. Don't forget to like, subscribe, and share this video with a friend who's preparing for the NCLEX. See you in the next practice session.